Now to the rapidly spreading COVID-19 Delta variant. Health officials are warning about a new spike in cases among young people and in communities of color. Last month, the Delta variant accounted for just over 2% of COVID cases in America. Now that number is up to 20%. We are learning of this spike just one day after the White House announced the U.S. will not reach its vaccination goal by the 4th of July. Dr. Anthony Fauci told CBS this morning he is not concerned about the U.S. missing that vaccination deadline.
We've done extremely well, so we're going to probably by the 4th of July be, 67, 68%. That's really good. The 70% aspirational goal by the 4th of July to get individuals with one single dose to get 70% of at least one dose was an aspirational goal, but it was never the end game. I mean, we want to go right through July 4th into the summer, continuing to get people vaccinated.
To talk more about this, I'm joined by Dr. Jerry Abraham. He is the vaccine director of Kedren Community Health Center in Los Angeles. Doctor, welcome. Great to see you again. Now, we know the Delta variant is more contagious and therefore moves faster through a community. We are seeing it not only infect, but kill some younger people and, within communities of color. Why is this happening, and what do we need to do to get a handle on it?
Great. Thank you again so much for having me. We're here from Kedren Vaccines live in South LA, and you see it's getting harder and harder to get people vaccinated. But absolutely, we're very concerned about these new variants, particularly this Delta variant that is more infectious, more contagious, perhaps even more deadly. And when we look at who's not vaccinated, when we look at young people, when we look at vaccination rates amongst Black and brown men, where vaccine rates are still lower than where we want them to be, definitely lower than other segments of the population, they are most vulnerable. So not being vaccinated goes hand in hand with who is most vulnerable, who is getting infected with this Delta variant. And of course, we're looking at this Delta variant becoming the most dominant strain here in the US and abroad. So those that are not vaccinated are the most vulnerable. And we know this is more contagious, more deadly. We don't have any moment to delay. Please get vaccinated if you haven't been vaccinated yet.
Now, as you mentioned, there's a large part of our population that is still not eligible to be vaccinated. And of course, we're referring to children under the age of 12. What are the concerns about how vulnerable they may be to this variant? Is it, for instance, making them sicker? And how do we protect them?
Yeah, absolutely. I mean, we really are doing everything we can to convey to parents, to young people. As you know, Pfizer is authorized for people 12 and older. We're in a mad dash, a race to get high schoolers, middle schoolers vaccinated. We've been partnering with community colleges, with parks and recs where young people are currently, and there's still a lot of hesitation, reluctance. People are still very concerned about getting their children vaccinated, and yet we still see that this Delta variant is infecting young people. We are still seeing ICU admissions. We are still seeing hospitalizations amongst children. And of course, children can also pass the Delta variant, pass COVID-19 on to their loved ones, including those not vaccinated in their community, in their household. So kids are still a very critical piece to the puzzle. Of course, we can't vaccinate children under 12, so they're absolutely susceptible. Again, being more contagious, more infectious, they are vulnerable. So we look forward to the day that 6 and over are eligible for vaccines. We just definitely need to make sure that everyone that is eligible, we answer their questions, we engage them, we reach out to them. We call them the hardly reached, not the hard to reach. We just need to do a better job of reaching people where they are. For example, this past weekend with Juneteenth, we were out in the community finding those remaining arms that need vaccines, but we're still meeting a lot of reluctance, a lot of hesitation, a lot of concerns by parents whether or not these vaccines are safe for them. And that is the message that I hope that your viewers hear. Vaccines are safe, they are free, they are effective, and our best tool at combating this new Delta variant.
Absolutely. And I want to ask you about the possibility of vaccine boosters coming for the fall. There's been a lot of talk about that. Some people say we will need one, some say we might not. But if the Delta variant takes hold and we do continue to see its percentage of COVID cases increase, and we do see cases surge, do you think where will we be regarding boosters in the fall, do you think?
Yeah, I mean, it's crazy when you look back at the whole journey we've been on since December when Pfizer received emergency use authorization to where we are today with Moderna and with Johnson & Johnson, other vaccines in the development pipeline as we watch more people becoming eligible for vaccines. We've come a long way with the millions having been vaccinated, but we are still very concerned when we look forward through the summer, into the fall, into flu and cold season. You know, when we look at these mutants, these variants, these strains, we don't know what the future holds. But what we do believe is that there may be people over 65, for example, people with underlying medical conditions that really will benefit from a booster. You've heard Pfizer, you've heard Moderna say that they are working on next generation and booster shots. Very likely that come this fall, those most vulnerable will need those booster shots to be most protected. Whether or not this becomes an annual vaccination, an annual inoculation event is still to be seen. However, we know that with the COVID-19 vaccines, maybe combining them with flu shots may be wise. We may see something where it's spaced out a little bit more like we do with tetanus or with hepatitis B. But either way, we know that first and foremost, make sure you get your shots, one shot Johnson & Johnson or two shots Pfizer and Moderna. And then for some, there very well likely will be a booster shot come this fall. Still too early to say definitively, but those discussions are currently going on. Absolutely.
Dr. Abraham, really quickly, we don't have a lot of time, but I want to just ask you, behind you, it doesn't look like there's a lot of activity, as you pointed out. Are you finding your vaccination efforts at this point are more about moving out and going into communities where you're finding that hesitancy and actively recruiting people to be vaccinated?
Yeah. Thank you so much for that question. I'm super excited to talk about that. As you know, I mean, we could stand here all day, but if people don't come in here and actually get vaccinated, you know, what is the point of having these vaccines here in these ice chests and coolers and refrigerators? So what we've really had to do is we've had to pivot our strategy. We partner with community-based and faith-based organizations, and we're taking the vaccines to where people live, work, worship, play, where they go to school, the public housing developments, factories, schools. That's really how we're going to get this last mile. This is that mile of health equity, and we need to meet people where they are out in the community, where they are right now. So we actually have mobile teams out there vaccinating in parks, in schools, in housing developments, and that's really how we're going to get to that 70% by July 4th that we hope that we can do for President Biden and Vice President Harris.
All right, good luck at your efforts. Dr. Jerry Abraham, thank you so much for joining us.